More than 31 million people in the U.S. have some form of eczema. The skin condition can affect both kids and adults. With October being Eczema Awareness Month, Dr. Camila Anita with the Skin People joins us this morning. Good morning. Thanks for coming in.
Good morning. Thanks for having me. Thank you.
So first of all, what is eczema? What can we tell people about the causes of eczema?
Yeah, so eczema is just skin inflammation, and it's actually an umbrella term because it encompasses a couple of different eczema. The really hallmark of it is itchy skin. So really red, peely. Sometimes people can have oozing or even cracks or blisterings, and it happens in certain parts of the body more often than not.
But it's mostly itchy. That's the telltale sign is I can't stop scratching this.
Exactly.
And is it more common in kids?
The traditional eczema, or people think of atopic dermatitis, is more common in kids, but then as I mentioned before, there are other types of eczema, and those can be more common in adults.
Yeah. Well, I feel because I had eczema as a kid and I outgrew it, and I feel that's kind of common. I feel that happens all the time. Is that true?
It is. And then the good news is the majority of the kids outgrow it. Sometimes it comes with asthma or allergies as well, so it's not uncommon for those kids to have those things as well. A few unlucky ones do grow up and keep eczema, but the majority of them do outgrow them.
That's good.
Yeah,
that's good news,
great,
especially for I think as parents, you really ache for your kids when they're so itchy and scratchy.
It is, and it's a lot. It's a lot because eczema is one of the things that you have to repair the skin barrier, and kids don't know how to do that. So it's a lot on the parents, it's a lot on the families. Kids are waking up multiple times at night, so it takes a toll on the family. People don't think about it, but it's a family disease.
We have kids. We both have young kids, and we understand the value of that sleep.
Yes.
Yeah. If one kid isn't sleeping, nobody's sleeping. So what can we do? Are these solutions for eczema here?
Yeah. So think about eczema as there's two things. One is you wanna kind of calm down the flare, and then sometimes you'll need medicines for that, like creams or pills or even injections we have now. But then you have a second phase, which is maintenance, because the idea of eczema is that your skin is broken down, their skin is not as good as it is, so you need to repair the skin barrier. So over-the-counter lotions that don't have any fragrances, that are very bland, that are very moisturizer, will help you kind of rebalance the skin. So that's kind of maintenance phase. And then when they have flares, you might need to grab that medicine that the doctor prescribed for you.
Okay, but Aveeno, Neutrogena, La Roche-Posay, I know that those are some favorites when it comes to very sensitive skin, simple formulas.
Yeah, so you want to, brand is kind of people's preference, but you want to stay away from fragrances, perfumes, anything that has a strong smell is a no-no for kids with eczema.
So it could be more aggravating.
Exactly, it can be irritant. So the other thing about eczema is that it's genetic in a sense, but it also can be triggered by irritants like fragrances or pollution or allergies. So there's a lot of things that come into play when it comes to eczema.
That's why you can have flare-ups too, because it probably depends on the environment.
Exactly.
Okay. What is this? I have some of this. I don't even know what it's for. It's water. Why do we need that?
Well, it's a special water. It's a water that comes from the French water, whatever, but it has some probiotics. So the idea is that with this spray, you actually are propping your skin to regenerate and repair itself.
Okay. Oh, interesting. Okay. So the health conditions that are associated with eczema, why is it so important to treat it and get it under control? What could it lead to if you don't?
Yeah, so a lot of the kids with eczema actually have ADHD and undiagnosed attention disorders because of the itching and because they can't sit still. So really allowing your kid to have the best chance of studying at school, you really have to calm down that itch and control that.
You mean because they're so distracted by something that's happening on their body that they can't focus?
We really don't know exactly what the link is, but a lot of kids with eczema do have that, so we don't know if it's the chicken or the egg, but treating the itch is a way you can help them control that.
Oh, interesting. Okay. So what are the symptoms that a parent might recognize in a child besides the itching, I guess? Is there anything else that they need to look out for?
So anything that is red, oozing, blisters, cracks, sometimes it get infected, and then you can get kind of a yellow crust on top of the skin, and that's called impetiginization, and that tells us that the skin is actually infected. So anything that seems that the skin is kind of angry, that's kind of like a telltale sign.
And so if you try these over-the-counter treatments and they don't work, then you really just need to see a dermatologist.
Yes. Yeah, a good rule of thumb is give it 2 weeks of morning and night use, and if your kid still has those itchy patches, come take it to a dermatologist or pediatrician to help out.
Do you need to look for this stuff? Because I don't see anything here that says like specifically for eczema, but there are stuff, there's over-the-counter options that do specifically say eczema treatment. Do those work?
Those work. It really, like I said, you really have to like look at the ingredients in the back. Some things that are labeled for eczema, they're not the greatest, so a lot of it's marketing too. So you just really have to know the principle, like bland, no fragrances, hydrating lotions is what you want.
All right, Dr. Camila Anita, is there anything else you'd like to tell people before we let you go?
No, just like to seek help. I feel like parents sometimes take it upon themselves to do it on their own, and it's okay, but sometimes you just need a little bit of guidance and help to get there.
Very good. All right, good to see you. The Skin People in Bel Air, that's where you can find her. We appreciate your time this morning.